Welcome everyone to the May meeting of the APHA's Environmental Justice Committee. We have a special feature today. We're going to be having a webinar with our friends from We Act for Environmental Justice and RMI to talk about what the health benefits are of switching from gas to electric stoves. We Act for Environmental Justice actually put out a report a few months ago called Out of Gas, In with Justice. And last year, APHA at the 2022 annual meeting passed a policy statement supporting the phase out of gas stoves in homes. Today, our guests, Annie Carforo, who's one of the researchers for the report and authors of the report, is going to present how they did the study and the findings. And then we have with us Annika Larson, also from We Act for Environmental Justice, and Emma Hines, who helped draft one of the authors of the APHA policy statement, who's with RMI, to talk about policy implications. You might have heard a lot about gas stoves in the news lately. It's because there's been several campaigns in states across the country to phase out fossil fuel use in buildings and in homes in particular. They do have a negative health impact on folks from the use of gas stoves, and more broadly, just the use of heating and cooling that relies on fossil fuels and the impacts that has on carbon emissions and other unhealthy emissions that also cause climate change as well as localized air pollution. So with that little introduction of our panel today, I'm going to kick it off and hand it over to Annie. Annie Carforo is the Climate Justice Campaigns Manager at We Act for Environmental Justice. She's responsible for engaging We Act members and residents of Northern Manhattan in the organization's climate policy initiatives and overseeing policies and programs that promote equitable land use in the community. She holds a Bachelor's of Science degree in Human and Organizational Development with a focus on community development from Vanderbilt University, and is currently pursuing a Master of Urban Planning degree at Hunter College with a focus on equity and sustainability in city planning. Annie, I'm going to hand it off to you.
Amazing. Thank you, Denise. And hi, everybody. Thank you so much for having me. I'm happy to be here today talking about our Out of Gas, In with Justice pilot project, which, as Denise laid out so well, was an air monitoring study to look at the impacts on air quality of transitioning affordable housing residents from gas stoves to induction stoves. So I'm going to go over a little bit about what we did, what we found, and the implications of that. So a little fun fact, Out of Gas, In with Justice was actually the first study of its kind that focused on the effects of residential cooking electrification with tenants in place in a public housing setting. So we conducted this pilot in New York City housing authorities, in a New York City Housing Authority building at 1471 Watson Avenue. This is a 96-unit building in the Bronx, New York. It's a Black and Latino community. It is a community that has been has real evidence of environmental racism, of decades of poor land use planning. There's a heavy industry around the housing. And for those of you, I apologize. I was very worried that was going to happen. I'm so sorry about that. For those of you that do know NYCHA, hold on one second. For those of you that do know NYCHA, I'm sorry, she'll stop in a minute. These are buildings that have have a lot of deferred maintenance. And so that poses, a lot of health risks for residents that are often exposed to all sorts of environmental hazards, whether that be mold, pests, asbestos, lead paint, etc. And so that's why we chose to focus on this community. We wanted to really help them understand, help see and measure the benefits of switching to zero emission electric appliances. And what we found is that this is key to realizing a healthy home for low-income New Yorkers and low-income, households across the country. All right. So our motivation behind this study was, it definitely came from a health perspective. It did also come from a climate perspective. In New York City, specifically, there's a big focus on decarbonizing our buildings because they are responsible for 70% of greenhouse gas emissions. But using fossil fuels in our buildings also contributes to localized air pollution that leads to almost 2,000 premature deaths across New York State annually. And it also leads to a lot of negative health impacts. So in New York City, where we are, a very dense urban area, we have a higher asthma diagnosis than the national average. And a recent study by RMI actually can attribute almost 19% of childhood asthma cases to having a gas stove in their home. New York State is also, one of the Northeast states that heavily relies on natural gas for cooking. About 60% of our households have a gas stove. So that's a pretty significant, an important finding for us to kind of connect the dots that we have relied on gas to cook for a very long time, and that is contributing to, higher rates of childhood asthma. And another study by RMI again showed that living in homes with a gas stove can actually increase a child's risk of developing asthma by 42%. And so again, with this community, we wanted to, that where they're also exposed to a lot of outdoor air quality exposures, that was a big reason and why we wanted to select a New York City Housing Authority building and make sure that we are giving these residents that, are not first in line for a lot of these interventions, a chance to really get the benefits of electrification. So looking at the area that we worked on, the little yellow dot is actually the building's address. And this is in an area that has a really high rate of asthma hospitalizations, one of the highest in the city. And again, just to kind of connect the dots that this is not a coincidence. This is done, this is the results of intentional policies, but Black and brown communities are more often the ones that are forced to burden polluting facilities. They have poor outdoor air quality. They also have poor indoor air quality. And in New York City, 80% of hospital visits for asthma in children and young adults identify as Black or Latinx. And so the neighborhood that we were working in has one of the highest rates of asthma hospitalizations in the city. And again, this is not a coincidence. This is an intentional, a result of policy decisions. So our study looked at two main pollutants. We measured nitrogen dioxide and carbon monoxide. There's a lot of health professionals on the call, so I don't need to get too in the weeds about why we selected these two pollutants specifically, but nitrogen dioxide was the one we were very interested in looking at because it is a pollutant that is produced by gas stoves, and it does damage to the human respiratory tract, which, as we just laid out, asthma is a really big problem in this community. And so we wanted to understand how we were decreasing people's exposure to nitrogen dioxide through the transitioning away from a gas stove. And again, I mentioned this earlier, but it is worth noting again that gas stoves, typically the negative impacts of a gas stove are exacerbated by the the conditions in an older home. That includes if the home is poorly ventilated, if they're dealing with other environmental hazards that are going to exacerbate, asthma-like symptoms. That also includes if the building is inadequately heated, which can lead to people using their ovens for heat, which can lead to really, really high exposures of indoor nitrogen dioxide concentrations. And these are kind of, unfortunately, the conditions that the folks at 1471 Watson are exposed to on a daily basis. And so, we wanted to keep that in mind as we were taking our measurements. So our pilot measured the health and social impacts of transitioning from a gas to induction stove through 3 tests. We did long-term kitchen air monitoring. We were in people over a 10-month period. We measured for about a week at a time, just people's daily air quality. So we left these little lunchbox looking devices in people's homes for a week. And we did that test 3 separate times spaced out over 10 months. We also did what's called the controlled cooking test, where we really wanted to isolate the stove. And so we cooked a standardized meal in homes that had gas stoves and in homes that had induction stoves through our pilot, and measured nitrogen dioxide in real time to see what the difference in air, in air pollution was at the time of cooking this meal between the two different cooking sources. And then the last study, which was one of, I think, a lot of our favorite pieces of this pilot, was the stove usability focus group. So we sat down with our participants and really got to hear from them their experience with this transition. So I'm going to jump into our long-term air monitoring results. So again, these were taken, we had 20 households participating, 10 households received an induction stove at the beginning of the pilot. The other 10 households served as our control group. They received their induction stove at the end of the pilot, but they had their gas stove while we were taking measurements. And we found that the households that had an induction stove saw a 35% reduction in their daily nitrogen dioxide concentrations compared to households with gas stoves, which is significant, considering we're only removing one appliance. We found that the highest concentrations of nitrogen dioxide exposure were eliminated when we replaced the gas stove with an induction stove. And what we were seeing was that households that had a gas stove we were measuring NO2 concentrations that were above what is considered safe for outdoor exposure set by the EPA's air quality index. And this was for chunks of time inside. We also found with carbon monoxide, we did see a significant decrease when we switched from an induction stove to a gas stove to an induction stove. It was, I think, encouraging to know that we weren't seeing concerningly high levels of carbon monoxide with the gas stove, but we did still see a significant reduction, and that is important, for people's health. So we took our results from the long-term air monitoring, and we wanted to understand what people's air quality looked like compared to certain air quality standards. So because the United States doesn't have indoor air quality standards, we use the World Health Organization's 24-hour guidelines for NO2 exposure. And then we also looked at when air quality inside people's homes was above what is considered safe for outdoor exposure, based on the EPA's outdoor air quality index. So the next graph, it kind of takes a minute for you to adjust to it, but basically we have our 20 households. The first 10 are the gas group. So these were the households that kept their gas stove for the entire duration of the study. On the right, you have the 10 households that were our intervention group or induction group. They had their gas stoves for the first air monitoring session, and then we put in their induction stoves, and the following 2 weeks of air monitoring were then with their induction stoves. And the measurement on the side is the percent of the total monitored hours in each household. And we looked at when how many hours people were at less than 13 parts per billion of NO2 concentrations, which is what the WHO recommends, were greater than 54 parts per billion, which is when the EPA's air quality index goes from good to moderate and could have an impact on sensitive groups, which the EPA defines as anyone that's under 18, over 64, or has a respiratory illness. And based just on age alone, 85% of our households had a permanent resident that was considered part of a sensitive group. And then the yellow is when it was in between, right? So it was the NO2 concentrations in people's homes were above what the WHO recommends, but we're below the EPA's AQI, where it goes from good to moderate. And so you can see when everybody had their gas stoves, there was some households had quite a few hours where their air quality was above what is considered safe by the EPA's AQI. And when we removed the gas stove, and we're looking now at the bottom right, you can see that those hours virtually disappear. However, we do still see a significant amount of time where we're above what the WHO considers safe. And that's something that I'm going to get into in a little bit. It is also worth noting that the baseline measurements were taken during between October and February, when it's coldest in New York. We did measure some 18-hour cooking events in some households. And when we talked to those households after saying, hey, these numbers look a little funky, they did inform us that, oh, I was using my oven to heat my apartment because the heat wasn't working. And so those are the households where we hypothesized that we were seeing, you know, the like majority of the hours being above 54 parts per billion. So just to zoom in again on this kind of the piece that where we transition from gas to induction, you can see that there is virtually no hours where people are above 54 parts per billion. But again, we are recognizing that indoor air quality is not at below 13 parts per billion, which is what the WHO recommends. And we hypothesized that we were catching a lot of confounders or just other NO2 polluting sources that were impacting people's air. And so we believed that some of these confounders could be the fact that this was a 96 unit building. And at the time of these measurements, only 10 apartments had induction stoves. So if your neighbors are cooking, you know, it's close quarters, that could have an impact. The fact that this building had a central boiler in the basement. We also found out later that the boiler had actually been damaged in a flood. And so they were running a temporary boiler in the backyard that was running on oil. And so that definitely, we believe, had an impact on certain people's homes, especially based on the configuration of the building, if you were towards the back of the building where the boiler was. Also, you know, this is a New York City neighborhood, and it's also at that to that fact a heavily polluted neighborhood. And so just having your windows open also could increase your NO2 concentrations. So this was an important discovery because while we did see this 35% reduction, and that is significant, I think this also highlighted for us the limitations of just doing these single appliance in swaps or interventions in apartments when you're thinking about, you know, the holistic health of the home. I'm going to go quickly because I think I'm running out of time, but we also, as I said, conducted these controlled cooking tests, which some of you might know, but this is a standard protocol that's used frequently in research. And we cooked the same exact meal, measured out in the same exact order at the same temperatures, 18 different times. 9 of those times we did in a household with a gas stove in the building, and 9 of those times we did it in households with an induction stove in the building. And while we were making this meal, we were measuring NO2 in real time. And what we found is that homes with their gas stoves were often had NO2 concentrations that were 190% higher than households with their induction stove while we were cooking. We would take 5 minutes of background readings before we would start cooking to kind of understand what the baseline was of NO2. And we saw that when we started cooking with the gas stoves, on average, NO2 jumped from 18 parts per billion to 197 parts per billion. There were some households, especially the ones that had older stoves. Some of these stoves we were using were 30 plus years old, where we saw the parts per billion concentration go to 400 ppb, which is, you know, very scary to watch. And then with the induction stove, we would measure background NO2, and, you know, NO2 would stay the same throughout the duration of the cooking test. You know, and the lines that you're seeing here, we overlaid this with the EPA's air quality index guidelines, and found that all of the times we were cooking on a gas stove, the air quality, the nitrogen dioxide concentrations were above what is considered unhealthy for sensitive groups. And at some points it did even cross that threshold, which is considered unhealthy for all groups. And this is just I think a very clear example of what's happening to nitrogen dioxide concentrations when you're using a gas stove versus an induction stove. These are just 2 separate individual tests that were a similar time length. And we found that, and you can see, you know, as the gas stove and the oven start to heat up, NO2 spikes, and it really stayed above that EPA threshold for, you know, basically the entire cooking test, 43 out of the 45 minutes, while the induction, you know, we saw very minimal to no change. Last is the stove usability focus groups. I'm really happy to report, you know, our participants ranged in age, race, ethnicity, experience, you know, cooking experience, everything. I would say the only unanimous or uniting variable between all of our households was that they loved their induction stove. We were really impressed about how easily people adopted this new technology. They had very little trouble adjusting. They preferred it to their gas stoves. So at the end of the study, we actually offered every household that they wanted to take their gas stove back, they could. And nobody took us up on that, which is great. But, they expressed different, beyond just health, which many of them did comment on, having asthma and coughing when they would use their stove, and not having chest pain anymore, which is anecdotal but important information for us to collect. But people were also really really appreciative of like the sense of safety that they had, knowing that they couldn't leave the gas on, they didn't have an open flame in their kitchen. Induction stoves are really safe. The cooktop actually stays cool while you're cooking, which is great if you have kids or pets. And people just thought that it was an overall better appliance. It cooked their food better than their gas stove. So key takeaways before I stop talking is that cooking with gas stoves results in acute indoor NO2 concentrations, which we saw from the controlled cooking tests, that are harmful to one's health, but are particularly harmful for sensitive groups. And when we're thinking about public housing, there are a lot of households that would be considered a part of a sensitive group. And so that's an important, distinction to make. We also found that induction stoves are a very welcome and viable electrification solution for low-income households. There was very little barrier to them adopting this technology. And in fact, when they were provided it and offered access to it, they wholeheartedly embraced it. The one-to-one appliance exchanges, they are going to improve air quality, as we saw that 35% reduction in just the removal of those highest concentrations of NO2. But what our study also showed is that there are a lot of other elements that are contributing to indoor air quality. And so we support it. We act transitioning entire buildings away from fossil fuels for the greatest impact. We would have loved to not have had that boiler going in the backyard and instead have had heat pumps, and et cetera. But, we know that this is a challenge because it's expensive to do a lot of this work. And so we really need to start seeing government programs package interventions so that they can be more holistic. Right now, they're very siloed, and I think that makes it really difficult for a lot of building owners to take action. But whole building retrofits are what's going to maximize benefits for residents' health. And it's important when we're thinking about low-income communities, when we're thinking about renters, which in New York, 70% of New Yorkers are renters. And in New York, we have a very old housing stock, structural deficiencies. This is going to be an uphill battle. And we need to see significant investments in building electrification, along with very robust tenant protections to make sure that landlords are not passing these costs down to tenants who are already burdened between rent and utility costs. And these are going to be really key if we plan to electrify a lot of this older housing stock. But it's also, from our study has shown, these communities should be the priority. They should be going first. And so we're going to, we continue to advocate for policies. And I know Annika's going to talk a little bit about this, that is making sure that federal dollars, state dollars, city dollars are going to these buildings to make sure that they're the first ones to benefit from the health impacts of electrification. All right, that's my slides. I don't know if we're doing questions now or maybe after the speakers.
I think we're going to do them after the speakers.
Cool. Yeah. Thank you, everyone.
All right, thank you. So I see a lot of policy or politically oriented questions in the Q&A, which we get a lot with this group. Always one of my favorite parts of the conversation. Our next two speakers are going to actually address some of those. So first up, we're going to have Emma Hines, who is with APHA member, and also, one second, started her screen share while I'm trying to read your intro. Hang on a second. So Emma is with RMI, which is formerly known as the Rocky Mountain Institute, and going to be talking to us today about the APHA policy statement, what that includes, and how we came about introducing that. Sorry, a lot of things on my screen are very blocked right now. Give me 1 second.
You want me to stop sharing for a second?
Yeah, if you could, that would be super helpful. I'm also on a different computer, so I can't, like, all my normal things are toggling wrong. Sorry about that, Emma. So Emma's a research fellow, was a research fellow at the Centers for Disease Control and Prevention, and taught with the Yale Climate Change and Health online certificate program, and regularly researches and educates about health and air quality co-benefits of building electrification. Annika Larson is also with WE ACT. She's in the Federal Policy Office in Washington, D.C., where she supports the office's federal advocacy, legislative, and regulatory work, with a focus on building electrification and healthy homes. Prior to joining WE ACT, she conducted research on the co-benefits of climate change mitigation for the Climate Trends chapter of the 5th National Climate Assessment at Columbia University, which I think some of the folks who are in the EJ committee and the climate change committee and the environment section are pretty familiar with that as well, which is super exciting. It's great to have one of the contributors from that joining us today. With that, I'm going to hand it over to Emma, and then you can go ahead, and then when you're finished, Annika, you could just pick up from there. Thank you.
Thanks, Denise, for the intro, and let me pull my slides up. And sorry, those were in your way for you for a minute there. So, hi everyone, thank you for having me today. And I'll say in advance that I'm at the tail end of recovering from COVID. So if my voice goes wonky at any point, that's why. But I am here today to introduce you all to APHA's new policy statement on this topic of gas stoves. And for those of you who may be a little bit less familiar with policy statements in general, my quick spiel is that APHA members can develop and propose policy statements on key public health topics, and these become official APHA policy after getting passed by the governing council at annual meetings. And overall, these policy statements are useful because they help shape APHA's position on legislation and regulation, and more generally, they highlight the latest research on certain topics, and they serve as a resource for those public health topics, both for APHA members, but also the general public. And our new statement on gas stoves was officially approved back at the November 2022 annual meeting. And I just have a couple of slides to share with you all so that hopefully you leave this meeting a little bit more familiar with the policy statement and APHA's position on this topic. So I'll do a little bit of self-intro as well and tell you about the rest of the expert team that worked on this statement. And I saw in our guest list today that we actually have 2 other authors with us. So thanks for being here, Theodora and Leon. Like Denise said, my name is Emma Hines. My background is in climate and health. I've been an APHA member for several years now, but worked in public health for longer than I've been a member. I work in the nonprofit world now at RMI, and I'm really glad to be here with Annie and Annika because we work closely with WE ACT on a daily basis. But this team started working on this gas stoves policy statement actually back in summer of 2021, starting with the fantastic efforts of the 2 folks here with stars above their names. Maya Mishra, who was an intern under Dr. Catherine Toms at the Florida Clinicians for Climate Action. And these 2 put together our first draft of this statement. And at that point, they came to the APHA Climate and Health Intersectional Council and myself directly to see if others wanted to join in on this process of finalizing a draft and then working it through the APHA process. So between this bunch of folks, we have topical expertise in air quality, medical and public health practice, epidemiology, building decarbonization, and climate change. So definitely a diverse set of backgrounds here. And for you all, I think a lot of the folks I saw on the line are probably familiar with this discourse on gas stoves because of its news coverage over the past couple of months, but this may be newer for others, and that's perfectly okay. Regardless, people tend to have relatively strong opinions about their stove, more so than other household appliances. And it's because they use these appliances every day, or this appliance every day, and are generally more familiar with the ins and outs of how it works than something like a boiler in your basement or a furnace in your attic. But across the US, gas is actually not the most common fuel over electricity when it comes to stoves. Nationally, and I know that Annie did a little bit of a New York centric focus here, so I'm going to zoom out a little bit more, but nationally gas stoves are in around a third of households, and that usage is highly dependent on state. So certain states like New York and California and Illinois, for example, use far more gas stoves than other states like those, especially in the southeastern region, which is highly electric as it stands. And we actually did a really good job of introducing the problem with gas stoves, so I'm not going to spend too much time here, but there are a couple of motivators behind the APHA gas stove policy that got us all together and working on this topic. So quickly, some of our motivators were the fact that gas stoves release some pretty nasty air pollutants, most notably nitrogen dioxide. They're also a relatively unique household appliance in that they aren't required to be, or universally required to be, vented to the outdoors like other combustion appliances are. We now have decades of research that connect gas stove usage to poor indoor air quality and certain health outcomes like asthma. We know certain populations like lower income households and children are particularly at risk. And to put that children's risk in perspective, we know now that exposure to gas combustion from stoves presents a similar risk to that of living in a home with a smoker. And all of this evidence we capture in our policy statement in a section that's called the problem statement. So that's the quick summary for you all. Another major section of our policy statement goes through the evidence-based strategies to address that problem. So I tried to think of a visual way to represent what took up many, many pages of text in our statement. And I thought that pillars seemed appropriate because we hypothesized that all of these pillars together support the creation of healthy homes without combustion pollution from stoves. So our statement promotes a holistic approach, including public education, exposure reduction tactics, which I'll talk a little bit more about in a moment, setting indoor air quality guidelines, performance standards for appliances, building codes, and the development of programs to spur electrification and healthy homes more generally. So all of these items together are key to addressing gas stove pollution. To zoom in on that one of exposure reduction, we spent a fair amount of time in our policy statement exploring 3 exposure reduction strategies. The first of which was electrification, which is this process that I'm showing here with arrows of transitioning away from gas and toward one of a few electric options, whether that's a glass smooth top stove or an induction stove like the We Act folks are talking about. But we also explored ventilation, which can be accomplished either mechanically with whole home or kitchen ventilation equipment, or naturally using windows, for example. And then lastly, we explored filtration, which is the process of filtering pollutants out of the air. And I won't get too nitty-gritty on any one of these, but quickly, what we found was the most effective solution based on the evidence is electrification, that process of shifting away from the use of gas. But there definitely is merit to these other strategies of ventilation and filtration. And these strategies can really help bridge the gap when electrification is not feasible. And there's a lot of reasons why that might be the case. So the last part of our statement is our action steps. And we had 13 in particular that I will not go through one by one for you, but these action steps are essentially voiced as APHA calling on other entities to take certain actions. And I think they fall into 2 main buckets of action steps. First, we call on several government agencies as well as public health and medical professionals to take that step of recognizing the link between gas stoves and health risks, and then taking steps that are within their authority. And we talk about those in a little bit more detail in the statement that can protect the public, shift attitudes, and boost understanding about this topic. And then the second bucket that we talk through is advocating for federal, state, and local policy options. And there are lots of options here, some that I've spoken about already, and I won't spend too much time on here, but things like performance standards, building codes, all that good stuff. So that's how we wrap up this policy statement. And my last slide for you that I had was just to show that even after the passage of this policy statement, that there has been a lot of action. And I wanted to show that the ball is rolling. For the statement itself, it has now been mentioned in over 40 media hits between news articles, radio shows, podcasts about gas stoves, which personally sounds like a lot of action for an APHA policy statement, but I don't have evidence to ground that statement in other than I think that's a lot. And then a lot of other things have happened too. You know, we have new studies on this topic showing that over 12% of the current childhood asthma burden in the US can be attributed to gas stove use. We have other really interesting studies showing that gas stoves can actually leak benzene when they're turned off and not in use. We also have new polling evidence showing that attitudes are swaying on this topic. In particular, this one poll that I pulled this photo from shows that many gas stove owning adults, especially parents, are showing interest in eventually replacing their stove after seeing that new study with the link to childhood asthma. In great news, there's also new funding available for this. The Inflation Reduction Act passed back in 2022 has up to $840 available for families to make that switch to electric or induction stoves. And then I know Annika will talk a little bit more about this here in a moment, but policy is developing in favor of all electric buildings, even since the passage of the statement. The latest is from New York State, where their budget includes provisions for going all electric in all new buildings. So I'll let Annika pick up from there, but thank you for letting me jump in for a couple of minutes. I hope that this was insightful about APHA's new policy statement and the position that they're taking on this really important issue. So I'll pass to Annika from here.
Great. Thank you so much, Emma. All right. So I wanted to just address a question that came up in the chat as well around WEACT. WEACT started in the late 80s, and then that was when we were serving, you know, the Harlem, upper northern Manhattan area. And then later on in 2012, we started an office in DC, which focuses a lot on federal policy. So those are our two main locations. And then we also convene what's called the Environmental Justice Leadership Forum, which has environmental justice organizations across the US. So to answer kind of where we are and where our focus is, just wanted to open with that. But to showcase some advancements in electrification policy, we can start with the New York policy context. You'll see that, you know, some of these advancements within New York City and the state itself include the local law 97, which requires buildings over 25,000 square feet to reduce emissions by 40% by 2030, and then 80% by 2050. And then in January 2022, Governor Hochul announced a plan to electrify 2 million homes by 2030 as part of the 2022 State of the State. And this plan allocated clean energy upgrades to 800,000 low and moderate income homes. So as you can see, there's a few others on the slide, but there's lots I want to uplift. So we are moving to the next. So again, I know Emma briefly touched on this, but New York State was the first to ban natural gas and other fossil fuels in most new buildings. This law requires all electric heating and cooking in new buildings shorter than 7 stories by 2026, and in 2029 for taller buildings. Though it does have some exemptions that it permits, it doesn't give cities and counties license to override the ban, which is a huge win. And so as New York is the first state to do such a ban, there's other cities across the US, over 100, who have enacted different policies that support climate-friendly buildings. Some examples include in Sacramento. Sacramento is requiring new buildings to run on 100% electricity. Chicago is passing an update to its building energy code that supports decarbonization. Ithaca voted to decarbonize buildings by 2030. The DC City Council is requiring net zero construction by 2026. Eugene became the first city in Oregon to restrict natural gas in new residential construction, and Washington State passed an all-electric heating mandate for buildings. These are just a few examples to name, but there's several others. I also wanted to uplift that the Bay Area Air Quality Management District voted to adopt a policy that, starting in 2027, will phase in requirements that only zero emission water heaters and furnaces are to be sold and installed in homes and buildings. And so, you know, this will have great impact as well. But I want to uplift that there's a lot more work to be done, and we know the gas industry is going to continue to fight back. So Berkeley was the first city in the nation to enact a gas ban, and that was struck down by the Ninth Circuit. So it's very important we use this momentum right now, and we continue to fight for various wins. And, you know, just a few other things in California to uplift is the California Air Resources Board is actively involved in the development of green building standards and updated indoor air quality guidelines. And to uplift our own Annie, she participated in one of their webinars that they did around, or a public workshop to discuss the health effects of indoor exposure to nitrogen dioxide, and then, you know, what that could mean for their indoor air quality guidelines. They want to update them as they know that they need to be more stringent. So that's just to name a select few. Then we also have some agency and congressional action taking place. So as maybe some of you have heard, the Consumer Product Safety Commission approved a request for information on the chronic hazards associated with gas ranges and proposed solutions. USDA and HUD just published a joint federal notice that updates their minimum standard for new construction of certain home finance and FHA insured properties, as well as USDA guaranteed single family homes. This is an important part of the two agencies' efforts to improve the efficiency of their single family and multifamily portfolios, but it only applies to new construction. DOE has also proposed a rule on energy conservation standards for consumer conventional cooking products. And then, you know, with the Bill Act and IRA, there's a lot of funds flowing through. And so some programs that agencies are offering now to tap into are HUD's Green and Resilient Retrofit Program. And then we also have DOE's Renew America's Nonprofit Program, which will provide $50 million to retrofit nonprofits. And a key part of this is fuel switching is explicitly allowed. So those are some there, as well as there is a proposed bipartisan bill to watch for that could be added into the Farm Bill, and it's the Heat Pump Energy Assistance and Training Act, introduced by Senator Welch and Marshall. So moving on as well, you know, just some things to keep in mind as we advocate for different policies. It's really important that we advocate for policies that restructure existing programs to focus on whole home retrofits with a prioritization of low income housing, that we adjust policies and programs to meet the needs of low income renters who have limited autonomy over housing conditions. You know, that we work to accelerate decarbonization and HUD funded housing, and that we pass policies that will get fossil fuels out of homes. So I can open it up for questions. And we can also go back now too and go through the chat if that's easier. And I'm happy to stop my share for that.
Yeah, I think you can stop the share. Thank you. There's a bunch of questions that were in the chat that were about the study itself. So I'm going to hand it over to Annie to answer those. And then we'll come back to some of the policy and political questions as well.
Perfect. Thank you, Denise. I'm going to run through the questions in the Q&A quickly, if that makes sense. The first question here, we have some critics say that gas stoves are more energy efficient than induction stoves. What recommendations do you have for us to counter this argument? So we actually did do some, back of the napkin analysis around this. And what we found is that because the induction stoves are actually much more efficient than gas stoves, they cook incredibly fast. So an example, to boil a pot of water on a gas stove that would take for like pasta, let's say, that would take, you know, anywhere from 12 to 18 minutes, takes about 4 minutes on the induction stove. And so we actually found that we were using less energy to do some of these cooking tests when we were using the induction stove, less electricity than we were using gas. And so I think there is, you know, I don't actually think that that is true, simply because the induction stoves are, you know, a really, really efficient and quick technology. They do require, you know, electricity, but you don't need to be cooking for as long as you would on a gas stove. The cost of switching to gas to induction is expensive, I will say. And the biggest challenge in older buildings is updating the electrical capacity. So in the building that we were working in, we found out at the beginning of the pilot that the electrical capacity of the building couldn't handle more than 2 stoves per vertical line. So this was a 6-story building. And so we could only put, you know, 2 stoves on the A line, 2 stoves on the B line. And so I didn't mention this in my presentation, but NYCHA, New York City Housing Authority, has actually selected 1471 Watson, where we conducted our pilot, to be their first all-electric retrofit. So they do have plans to fully electrify this building, and updating just the amount of energy going to the building, you know, from the street is going to be, you know, an expense, and then updating all the wiring in the building is expensive. For our pilot, we spent about $1,500 to rewire each apartment. So $1,500 per apartment. And that was to put a 40 amp pole breaker, I think I'm saying that correctly, in the apartments, as well as a 220 volt outlet in the kitchen to plug the stove in. And then we had to purchase the stoves, which actually I would say are cost comparable to gas stoves at this point. There's a range of induction stoves. You could get a very nice one. You could get a very standard one. We purchased 4 burner induction stoves with a convection oven. It cost $1,500 per unit, but because we bought in bulk, they actually came out to about $1,100 per unit. And now the IRA actually has rebates to purchase inductions and electric stoves. So you can save $840 if you're thinking about replacing your gas stove with an induction stove through the IRA, which makes it very cost efficient to switch. But the challenge is the electric. So data is compelling, but naysayers are claiming loss of freedom of choice, personal rights, wrecking the kitchen appliance industry, Big Brother, let's list a few. Something that WEACT, I think, is very clear with is that we are not forcing anybody to do this transition, but what we do want to make sure is that people have choice. And right now, if you are a renter in a low-income building, you don't have a choice of what your cooking fuel is. And so we want to make it more accessible so that those people who, you know, are looking at this research feel want to protect their family, want to transition away from gas, actually have the opportunity to do so. And so we want to keep your choice, but we want to make it so that, you know, it's just as easy to switch to induction as it is to stay with your gas. We did provide pots and pans for our participants. The next question was, did you provide pots and pans? For those that don't know, induction stoves, they actually work based off electromagnetic, based off of electromagnetism. I don't know what that word is, sorry. But you need to have magnetic pots to basically activate the stove. And so we knew that that was going to be a really big cost burden for households that are either low income or on fixed income. And so we purchased a 14-piece set of induction ready pots and pans. And people loved them. You know, there was a couple of concerns that folks had, like culturally relevant, you know, rice pots that they didn't want to give up, but that were not induction ready. But I will say that after receiving the new stove and the pots and pans, those concerns and complaints kind of fizzled very quickly, and we didn't really hear about, you know, the old pots or pans anymore. For clarity, did they remove the gas stove in each of the homes, or did they just disconnect the gas? So we disconnected the gas to those apartments, and we removed the gas stove and replaced it with an induction stove. Did any of the homes have air purifiers? Only maybe 1 or 2. We, oh man, these are all coming, okay. we did a survey at the beginning and at the end of each monitoring period, and we had a list of questions to try and just get at like other things that they might be doing in their homes that are interfering with our readings. And one of the things that we did ask was about air purifiers. What I will say is that of the 20 homes we were in, not a single one had a working range hood. And so the ventilation in these kitchens is it doesn't exist. There are windows in the kitchens, but sometimes the window would be like on the opposite side of like the room. So, you know, if it's like kitchen and then like a room and then a window. And so that was a real challenge because people didn't have adequate ventilation in these apartments. Okay. How much did they ask? How much do the participants cook to begin with? Yes. So when we were doing our initial recruitment, we had a couple of kind of like a checklist that people needed to meet. And one of those was that they had to cook. If they were somebody who was never home, who was, you know, getting takeout, who was not really maybe using the microwave more than they were using the oven and the stove, we didn't ultimately select that household because we did want to have a robust data set. We also had to make sure that they were going to be home for the 10-month period. Some people might, you know, go away for the summer, go visit family. And so we did have to kind of consider those factors along with, again, as we mentioned, the vertical line, making sure we weren't recruiting more than 2 houses at a time. Okay, did you assess the willingness to switch from gas to electric before the intervention compared to willingness to switch after the intervention? So we didn't formally measure this, but what I can tell you is, so we knocked on every single door in this apartment building. We did get our 20 households. We got a lot of skepticism and a lot of no's. Once the first 10 stoves were installed in the apartments, I was really happy to see that there was like there's a very active community in this building. People are friends, they talk, they visit each other's apartments. And once we installed those first 10 induction stoves, we had about 8 or 9 households actually come to us and ask us if they could participate in the pilot, which, you know, I think shows, again, word of mouth and just exposure is a really great selling point for communities, you know, across the board. And it is, you know, we are excited, even though we know it's going to take time for NYCHA to ultimately electrify this whole building. I think there will be some households that maybe, you know, are still skeptical, but we were seeing, you know, a lot more people come to us with interest once the initial stoves were installed. I think that I got to
Annie, there was
questions, and I think Emma wanted to add something from a broader outside New York City perspective.
Well, I was going to say, Annie, for one question, I just typed an answer and it cleared it, and I didn't mean for it to go all the way. It was asking about concerns during power outages and how folks can continue to cook during an outage when they have induction. I responded that there's some newer technology that's very cool where induction stoves are actually being built with batteries built in to partially address that concern, but I wanted to let WEACT answer the question. Sorry for clearing it.
Yeah, no, that's a great answer. And I think that we also I think it's important to think no technology is perfect or foolproof. Ideally, we are also fortifying our grid and improving our grid's capacity and resiliency so that we aren't experiencing power outages when it gets too hot or if there's a, you know, big rainstorm. But, you know, that will still happen. And if your stove is electric, your stove won't work for the duration of that power outage. In New York, power outage durations on average are like, I forget what the number is, but it's like 17 hours. So it's like about a day. I think what is important to note is that there are currently in the New York City Housing Authority's portfolio, there are 61 apartment buildings right now that do not have gas. The gas pipes actually broke. And if you are without gas, that is months. And so those households there are 2 buildings that have been without gas for upwards of a year. And there are, you know, multiple buildings that are without gas for, you know, 6 months, 8 months, et cetera. And so it's a much harder fix if your gas goes out and now you don't have access to your gas stove than if your electric goes out and you don't have access to your electric stove for, you know, the hours that it would take to fix it.
Thanks, Annie. Emma, were you going to add anything else?
Well, I know we're just at about time here.
Yeah,
so
I
maybe
wanted to
the
do a
last
couple
thing that I'll say is sort of just putting a bow on the APHA position part of this. So I see a lot of questions about like, well, folks may have preference for gas or they don't want their, liberties taken away. So I can answer this from the perspective of what does the policy statement say that APHA has passed. So we acknowledge that a lot of folks do prefer gas for whatever reason. And this statement is really aiming to educate about the indoor air pollution coming from gas stoves and the health risks that are posed in these households. The statement does not directly advocate for the immediate removal of gas stoves, or even the banning word is not really said in the statement. Instead, it says that the switch to an electric stove is often most feasible in new construction and at the end of an existing gas stove's life when you already need to switch. But in some households, like those that have the financial means and control over their environment, they may choose to replace sooner for the immediate health benefits and benefits to their indoor air quality. So just wanted to answer from the perspective of what does APHA say about this, to put a bow on things. But thanks so much to the We Act folks for talking about awesome developments in this field since the statement came out.
Thanks, Emma. Annika, did you want to add anything on or have any final comments?
I think Emma tied that really well, but I do think there's momentum right now to capitalize on. And so I think being careful too around the whole, keeping there's momentous health impacts to like switching. There's tons and tons of benefits, as well as cities and like other jurisdictions are clearly open. And we see, attorney generals